All right, so one of the things I've been giving a lot of thought to is trying to help small businesses understand how direct primary care can be so incredibly valuable and how it can save money. And I talk a lot about, helping them see, okay, your premium, how that doesn't necessarily equal healthcare to your employees. That using Buca plans, which is Blue Cross, United, Healthcare, Cigna, and Aetna, the big health insurance companies, right? That doesn't equal access to your employees. That doesn't mean they're necessarily keeping your employees healthy for the amount of money that you're spending. And even with these conversations, I'm still finding there's like a disconnect, right? The message is not right or something. So bear with me. I'm going to try to run through the math, and I'm hoping that helps, small businesses, and really the sweet spot. I mean, it can help large entities as well, but at least from my perspective, as an owner of a direct primary care practice, Cervi Direct Health here in Portland, my goal is to work with small employers, 5 to 50, to really start to not just save money, but just take really good care of your employees, keep them healthy, keep them well. And yeah, there's some benefit on the bottom line, but selfishly, it's about just giving people good healthcare and giving them access. So I'm going to try to run through some math, and hope that helps, and hopefully I'm successful. I'll look at the numbers. On average, and I'm going to use some pretty round numbers just to make things easy. So on average, a family plan costs, an employer, let's say $24,000 a year to insure a family. The crazy thing is this money, that's just the premium, right? So if you think about it, the premium is, there's no actual care here. There's no, you're not actually paying for anything. This is just like a permission to get in line kind of thing, right? There's no actual care being delivered for that premium. It's just the cost of doing business. It's the cost of having insurance there if that happens. And a portion of that is paid by the employer, and then a portion is paid by the employee. Now, if you look at direct primary care, again, super round numbers, I'm going to say 300 is the number. And if we say it costs $300 a month, so that's $3,600 a year. And this is actually for care, right? So what do I mean by that? That means for that $3,600 a year or $300 a month for a family, that is delivery of actual care to that employee and their family. That means direct access to a physician. So they get direct access. Oh, that light is brutal. To a physician. Well, physician in my case, there's some extenders and nurse practitioners, but again, in the case of Cervi Direct Health, you get direct access to me, Dr. Dunbar, a physician. I'm talking text, email. This includes, again, their annual visit, right? And sometimes this is all included, right? So when people do kind of Buca plans, they get one visit a year that's considered their annual visit or their wellness visit, and that doesn't cost, quote unquote, cost anything. So again, that annual visit is included. The other thing that's included is any acute visits. So if you think about it, you get your once a year visit. God forbid you actually have a cough, cold, runny nose. Oh, you think you have a urinary tract infection. You're going to your doctor. You've paid now, right, $24,000 a year. There's no care involved in there. You go to your doctor. Now you're saddled with, again, a copay. This is the employee. You're saddled with a copay. Then there's a bill, right? It's called evaluation and management. So there's an E&M code assigned to the visit based on the complexity of that visit. So there's a bill associated with that. If they do any point of care testing, so you think you have a urinary tract infection, so they're checking your urine. Oh, you think you have strep throat, so they're checking to see if you have that. All that point of care testing, that's added dollars, right? The E&M code, money. Copay, money. When it comes to the employee, all of this goes towards your deductible. So you're paying this 100% until you meet your deductible. Maybe that's $6,000, maybe that's $8,000, maybe that's $10,000. So you're paying your portion of your premium every single month Plus, every time you go to your doctor, you're going to pay 100% of that visit, all these acute visits, until you meet your deductible, right? Then you say, oh gosh, you're sick. You call your doc. I know this never happens to anybody, right? They call their physician, they call their office, and they're like, I'm sick, I need to be seen. And they're like, it's going to take about 6 months. So now you got to go to urgent care. So on top of, again, all of this, now you got to go to urgent care. Well, there's an even bigger copay with that. There's definitely a bigger E&M code. Then you've got x-ray, point of care testing. The wrinkle in this may be billed as a hospital visit. You may think you're going to an outpatient facility, but the outpatient facility actually bills as a hospital. So now you actually get hospital fees. Again, you, employee, are 100% responsible for that bill because you haven't met your deductible yet, right? So all of this you're paying. Now, let's go direct primary care. So here we are. You pay your $300 a month, or your employer pays your $300 a month. The benefit is when these plans are crafted, again, the employer pays for the DPC. The employee does not pay because it's so much less expensive, right? This $3,600 a year is significantly less than what the employee's portion is under a BUCA plan, right? So this is your BUCA plan, right? So this employer's cost, this $3,600, is pennies compared to what they're paying. So for a family, they're probably paying, I don't know, 80% of that, 70% of that. And here they pay $3,600, but it's for actual care. It's for direct access, text, email. It's for same or next day appointments. It's the annual visit. It's the acute visits. It's, oh gosh, I think I need to go urgent care. No, you don't. You just come to your DPC, right? All of that is included in this number. There's no additional bills. There's no E&M code. There's no point of care testing. There's nothing on the back end. It's all included in that number. That's on the family side. Now, of course, things happen, right? So then you got to go see, something happens, you need to see a specialist. Oh, hold on. You have to see a specialist. Maybe something happens and you need to go to the emergency room or the emergency department, or you need surgery. God forbid you get cancer, right? Or some large healthcare expense. This is the catastrophic stuff, right? Maybe not a specialist, but these are the catastrophic things. Again, under a BUCA plan, you're paying 100% of that for some cases, and we can get into some nuances depending on the plan, because maybe specialists, they pay a percentage, the emergency room, they being the insurance will pay a percentage, but for the most part, you're going to be paying out of pocket, right, until you meet that deductible. When we do direct primary care and we use other entities that are now have transparency and are showing you the cost up front, meaning you employer, you can craft and say, okay, what do I need? And in most cases, crafting this health plan with DPC at the center, because 80 to 90% of healthcare needs is this stuff right in here, right? This is 80 to 90%. That's what you need covered. This 20%, that's what these other health plans are going to design for you, right? But if you can imagine, if you can say, okay, I can plan for 80 to 90% of my healthcare costs for my employees, and I know it's going to be a flat $300 a month, oh my gosh, how much does that save you money? You can plan for that. And then you craft the health plan to account for those 20%. And there's entities out there that are working with employers right now nationally that are helping employers craft these plans and are coming in 20 to 30% less, right, than what they're paying using BUCA plans. And there's full transparency, right? You're not paying this ridiculous amount of money just to get in line, just to play ball. It's not, again, this is not for actual care. You're not being hampered by these E&M codes and ticky-tack point-of-care testing bills and that kind of thing. Medications we haven't touched on. Labs we haven't touched on, right? All those things, again, add money both to the employee and the employer. Under DPC, we get those things at wholesale, significantly less. In most cases, generics are no cost. As far as medications, labs are, pennies on the dollar. I can get a CBC for $3. So this is kind of a sloppy little thing, but I'm just blown away that employers continue to pay this, right? You continue to do this ridiculous sort of premium, and it's not even for care for your employees. They can't get in when they need to. They don't have access to their doc, so they're using urgent care. They're missing work days. They're not healthy. They're racking up chronic disease, which just adds more cost, which adds more absenteeism. There's just another way. There's another way. And that's where I think direct primary care just shines. It shines above all else as far as quality of care, access to care, and it saves dollars. I mean, there's an immediate return on the difference between these two costs. There's an immediate return because all of this goes away, right? This E&M code, the point of care testing, all of that goes away. And then there's avoided stuff, right? Because again, if we keep people healthy, they can see their doc when they need to, then things aren't getting out of control and people aren't ending up in the emergency room, right? For the most part, we can keep people healthy and save some money. So there's avoided claims in that sense. And then there's just health outcomes, which takes a little bit longer to realize, but it happens, right? Because we're keeping people healthy. So you don't have these downstream consequences of poor health. So hopefully that's helpful. But yeah, if anybody's interested, be happy to talk to any employer. Again, kind of 5 to 50 is 5 to 50 employees. Be happy to talk to you. And even if you're like a super small entity where you're not able to provide full care, insurance, major medical, but you want to be able to provide care for your access for your employees and you just want to pay the DPC rate, that's also an option. And that's something we can definitely talk about. So be happy. Again, hopefully this is helpful.